Hi, good evening, everybody. Today we will see about the remaining clinical anatomies. Okay, today we are going to see about the clinical anatomy of carpal bones. So the first clinical anatomy of carpal bone is the fracture, fracture of scaphoid, which is very common, and the bone fractures through the ways at right angles to its long axis. So this is the scaphoid space which present in the wrist. Cause of the fracture is the fall on the outstretched hand or on the tip of the fingers. Fracture in the scaphoid causes the tenderness and swelling in the anatomical snuff box. Pain in the thumb and index finger. Disability is more seen in the usually the scaphoid bone is present in the wrist, but the disability is seen more common or more seen in the mid-carpal joint than the wrist joint. Mm. Scaphoid is present here. If the scaphoid bone is fractured, usually the fractured spot will get swollen or pain or discomfort or disability. But but in this condition, but in this case, the scaphoid fracture happens in the wrist, but there is no comparatively lesser disability in the wrist joint than the mid-carpal, because the mid-carpal joint has more disability more in mid-carpal joints than the wrist joint. Because of the wrist joint movements or present in the wrist, there will be sometimes the non-union can occur or avascular necrosis can occur in the bone. That causes the pain in the anatomical snuff box. Sometimes non-union or avascular necrosis seen in the bone. So this causes the pain in the anatomical snuff box. The avascular necrosis, how it will occur in the fracture. So usually the scaphoid has two blood vessels with supplying the scaphoid enter in two different pathways. One is entering in the palmar surface and another one is entering on the dorsal surface of body, and this is entered in the tubercle. Sometimes these, in most of the 13 percentage of cases, these two enters in one path. These two enters in one path, that is through the tubercle or through the distal half of the body. Then, then in that cases, distal half of the body. So, in that cases, if the fracture is happened, there might be decreased blood supply to the bone or the wrist. This leads to the avascular necrosis. I hope you guys understood. If you have any doubts, please comment or give a ping. And the second clinical anatomy of the carpal bones is dislocation of lunate. Dislocation of lunate can be produced by fall on the acutely dorsiflex hand with the elbow joint, which is flexed. So this placed the lunate anteriorly. So this displaces the lunate anteriorly, leading to carpal tunnel syndrome. So the next clinical anatomy is the metacarpal bones. So the first clinical anatomy of metacarpal is the obviously the fracture of the base of the first metacarpal bone. First metacarpal bone is the thumb. It is not the little finger. The anatomically, the first finger is not the little finger. It's always the thumb. So the fracture occurs at the base of the first metacarpal bone. It is known as the Bennett's fracture. Bennett's fracture. So this fracture involves the anterior part of the base. So this is the thumb. Anterior part of the bone gets anterior part of the metacarpal bone gets fractured. So, so the thumb is forced into the semi-flexed position and cannot be opposed. And the fist cannot be clenched. The second is the other metacarpal bones also can get fractured. They also can get fractured by direct or indirect violence. By direct or indirect violence. So the direct usually displaces the fracture segment fracture segment forwards, and the indirect one displaces them backwards. So why this is information and where it is useful to find out any medical legal issues or any cases, or in the case of abuse for the any crime, these things important. If the violence is direct, the fracture segment moves or displaces forward. If there is indirect, then it is backwards. Indirect is like fall or any accident, but direct will come under the medical legal cases that might involve legal issues, legal authorities. So it is very important to notice all these things also when it is fractured. People may get beaten up or beat someone. In that cases, it is very useful. So the third clinical anatomy is the tuberculosis or syphilitic diseases of metacarpal phalanges in children. It is tuberculosis or syphilitic diseases of metacarpal or phalanges in children. These disease affects the bone, especially in the middle of diaphysis rather than the metaphysis. Middle of the diaphysis. The diaphysis is affected rather than the metaphysis because the nutrition artery breaks it into the plexus, which immediately reaches the medullary cavity. Why it is not affecting this and affecting this? Because the nutrition artery breaks up into the plexus and immediately reaching the medullary cavity. Why it is very common in child, not in adult? Anyone? It is very common in child, but not in adult. It is common in child, not in adults. Why? Because the nutrition artery is replaced in the adults. It doesn't mean that disease does not occur in adults, but it will occur in another forms, different forms like infection that can be treated and is replaced by the periosteal vessel. And the fourth clinical anatomy is of metacarpal is sometimes the people have 6 fingers rather than the 5. This clinical is called as the poly polydactyly. Why is this happening? When when the thumb possesses the 3 phalanges, the first metacarpal has 2 faces. First metacarpal has 2 epiphyses, one at each end. Occasionally, the first metacarpal bifurcates distally. Then, medial branch has no distal epiphyses. So, occasionally, the first metacarpal bifurcates, it is fuses distally. Then the medial branch has no distal epiphysis and has only 2 phalanges. The lateral branch has a distal epiphysis and 3 phalanges. Now the phalanges. Phalanges has only one clinical anatomy, that is the fracture of distal phalanges of middle fingers is the commonest. Fracture of the phalanges, which is the distal in the middle finger, is common. This fracture is treated by treated by splinting. What is meant by splinting? Splinting the injured phalanx to the adjacent normal phalanges. So, if the middle one is fractured, what doctors do is, what we do is splint these two, which is called the buddy splint of the fingers. Joining these two and make a band-aid, or to mobilize this, sorry, to immobilize the fracture. This is also known as the buddy splint. So the rest we see in the upcoming lives. Thank you so much for watching. If you have any doubts, please do comment. If you want to have all these kinds of videos, like the content, please do subscribe and check out the YouTube channel. Thank you so much.